Hello everyone and welcome to Trust TV. I'm your host Memo Hea, and with us we have Dr. John Willardsen. Thank you for being here.
Thanks, Memo.
Make sure you subscribe to our channel, you hit that like button, and if you have any questions, feel free to leave a comment in the section below. Today we're going to talk about something that I've been seeing quite a bit lately. Actually, I've seen billboards on the freeways, YouTube videos, I've seen ads on social media, and it is the claim that other practices are making that they can get a patient a full set of dental implants in 24 hours. Now, Dr. Wilson, from your experience, is this really possible? Can this really be done in 24 hours?
Well, of course, yes, they can claim that, and some cases they may be able to do in 24 hours. But that's a very risky claim, if you know what I mean. In the videos that we've shot in the past, and we talk about the body, the healing, the properties of healing. For example, I've broken a few bones in my day in some of the activities that I enjoy. When somebody breaks a bone, a sigma is 3 months. So 1 sigma is 3 months of healing, and that's for the initial healing of a broken bone. So 2 sigma is 6 months, because it's, every 3 months is a sigma. And by 2 sigma or six months, the bone is pretty stable. Like you can run again, or if it's your arm, you can start lifting weights again. But at 3 months or 1 sigma, say you broke your ulna radius in your arm, it would be not recommended to go and do some curls or start lifting yet, because that bone is not fully matured. It has not healed completely. It's healed enough to the where you can take the cast off and start to utilize it, but the bone is not fully healed. So and we're dealing with dental implants, we're dealing with bone, and there's just no fast or simple way around the healing properties and the physiology, the healing properties of the body. So, to answer the question, is it possible to do a full set of dental implants in 24 hours? One of the marketing ads that I've seen is that you go in, they place their 4 implants, and then the next day you come in and get the permanent set of teeth. That is it possible? Yes. Is the outcome optimal? Absolutely no way, because one, just the bone healing properties like we've talked about, letting the bone heal around those implants, and you can get good primary stability on an implant. So when I place an implant, I under-prepare the hole or the osteotomy so that I get good rigid fixation of the screw. When I'm torquing it, I get high torque values. So technically, yes, I could load that implant, but there's other variables that I have to take into consideration. How much did I have to graft? Was there sinus grafts involved? Was there grafting anywhere around the implant that needs to integrate?
So explain that a little bit. What does that mean?
Okay, so oftentimes first let's go back to the initial aspect of placing a dental implant. First you have to make an incision. So you have to cut the gum and pull the gum tissue away from the bone, separate the bone from the tissue, so that you can get a good visual on the bone, because the bone itself has, it's got architecture. The morphology, meaning like the shape of the bone, is different on every patient, every case, every tooth site. The dynamics of the bone or the shape of the bone is different. So I have to take that into consideration when I'm placing the implant. So let's say I have a perfectly healed site and it's only 1 tooth. Oftentimes I don't have to raise a flap. I can just, obviously I'll look at my CAT scan and I know I've got plenty of the dimensions or the diameter of the bone is sufficient to where I can place like a 5 mm diameter implant. So sometimes I can just drill right through the tissue and then use what's called a tissue punch, where I remove that tissue, and I'm measuring all the time. The entire procedure I'm measuring, making sure I'm not outside the parameters of the bone, because the implant has to be surrounded by bone. If it's not, if let's say, and I have some images of doctor or x-rays that I've seen post-operatively of cases that have come through the office where the implant is literally sitting outside the ridge. So, let's say the ridge is here, the implant should be directly in the middle of the ridge, but it's off the side. So the entire, part of the implant, like the front side or the buccal side of the implant, all of the threads are outside the bone. And that's a recipe for disaster, because if those threads are not covered, then the bacteria is just going to harbor and just grow in that area. That implant for sure will be a failure. Sometimes we have cases where I'm placing implants and I've got quite a few threads that are exposed, meaning that they aren't fully covered in bone, but I have, let's say I pulled a tooth out and then there's a defect in the bone. So I'll prepare the hole, place the implant, and then I'll graft that entire area so that all of my threads are fully covered with bone. And unless I've raised a flap and I'm visually looking at that site, and can separate the gum tissue from the bone, that's the only way that I can have success with a case or an implant that is not fully surrounded 360 degrees of bone. And so the graft material acts as a matrix, and that bone will regenerate. I'll place the implant, or I'll pull the tooth out, place the implant, do the bone graft, and then I'll put a membrane over the graft to separate the membrane or the implant, the bone from the tissue and the implant. So kind of long-winded, but there's so many facets, and that's really my point in implant surgery, that, like I've said many times, you cannot dumb down this procedure. You can't dumb it down to the point of where you offer every single patient, you come in one day and the very next day you get the final prosthesis. One thing that pops into my head in talking about this is, when I do a case and I've made an incision, say from one side to the other side, a full incision, I've placed all my implants, grafted, I've got good torque on all the implants. Technically, I could load the case right away, meaning put pressure on the implants. But there's a huge variable with that, and that is the tissue. Mm-hmm. The tissue is going to shrink. Initially there's edema, swelling, and then you've got the membrane, the bone graft. All of that is going to settle down. And so let's say, for example, I placed my implants and then I have the patient come back the very next day and I put the bridge or the prosthesis in the patient's mouth. Within about 1 sigma or 3 months, there's going to be a gap between the gum tissue and the bridge or the prosthesis that's like probably 4 or 5 millimeters distance, because all the edema and the swelling has now settled down, but the molds or impressions that I made preoperatively or before the surgery is completely different than what the patient now has in their mouth postoperatively or after I've done the procedure. And so, those are variables that we cannot change. I mean, that has to, the body has to go through its processes in order to, heal and get proper adaptation, integration to the implant. Why would it be an issue if there's a 5 millimeter gap between the bridge and the gum? Because it's going to get completely impacted and filled with food. Every time the patient eats, it's just, they're going to be, they have a cheeseburger and half of it's going to be stuck between the bridge and the tissue. So that alone for me is a complete impasse would never do it, would never even claim or offer that in an advertisement, because the precision of the prosthesis is completely off. There's no precision. So again, to build an entire practice or a company around the process of putting in implants and the next day getting the final prosthesis, it's really just not smart. And it's trying to dumb down a very beautiful, aesthetic, functional, long-term end result. It's not possible, you know, because the body has to heal, and there's simply no magic technique, whether it's surgically or prosthetically, there is no magic to speed that process up. So anybody who's claiming that they're giving the permanent final prosthesis within 24 hours after a properly executed surgery, that's just simply not, it's just not possible.
Right.
So
yeah,
long-winded answer to but an important question, because, how does a patient know? I mean, it sounds great to walk in and then walk out with teeth this very next day. I mean, the final thing's done and you're good to go. But you're kind of buying something that's not realistic. And that's part of our goal here at Trust TV and at Trust Implants, is it's not to expose, but it's to educate. These patients they're putting all of their trust in the doctor, Yeah. They're putting their trust in the process. They're putting their trust in the science behind this wonderful procedure that is transformative and life-changing, but it can be catastrophic if, certain protocols are not followed by the book. And claiming to provide the final prosthesis and load implants that were placed 24 hours prior with that final prosthesis is just simply, it's not realistic.
Yeah. Well, I mean, you just, like you said, you were long-winded, but at the same time, I feel like you didn't really dive too much into bone grafting, but you explained quite a bit of what it is, and it just made me think that even just bone grafting, that's the whole
one
process.
step.
It's one step.
That's just one step out of many, many steps to get to the final.
Yes.
A well-executed, what we're trying to do is mimic nature. Again, it's biomimetics. We are biomechanically and biologically trying to mimic what God gave us with our teeth, the gum tissue, the bone. We're trying to replace all of that with artificial materials. So the biomimetics, if we're going to mimic nature as close to nature as possible, given the fact that they are not natural materials, we have to follow certain steps and protocols so that when we do that process of mimicking nature, we get as close to that, ideal aesthetic and function as we possibly can. And doing that, mimicking nature in 24 hours, it's not possible. So, for me, it's, I see these companies that are literally building their entire protocols and their entire marketing scam campaigns around getting teeth in 24 hours. And I just scratch my head just thinking, man, I mean, that would be great. I'd love to do it too,
Yeah, of course.
I would love to, but realistically, I would never do that to my patients, because I want long-term results. When we do a case, and then I see the patient a year, 2 years, 5 years, 10 years after, if everything has, fallen apart, I have failed, as a doctor. So, it just, I would caution, highly caution patients who are considering the procedure to do their research, do their homework. In reality, stay away from these, practices that make promises that just aren't realistic,
Yeah. Well, and also what you're saying, it sounds nice. It makes sense. Like I'm not like if I'm building a house and someone comes to me and they say, "Hey, let me build a house in 24 hours or let's say a week."
Yeah.
I mean, that'd be really nice.
Right.
But I know it's going to fall apart.
Yeah,
3 months
somewhere
later.
they're going to cut corners. Like,
Exactly.
is it possible? Yeah, I guess. I'm not a contractor, but I know in the constructions and the reconstructions that I do in patients' mouths, the variables that I have to consider so that I can stand behind this structure that I've built to replace an incredibly important organ, so to speak. Our mouth is essentially an organ. It's the beginning of our digestive tract. It's the beginning of even our psyche and our self-confidence. We are judged by our smiles. We're judged by our teeth oftentimes. And so in order, if somebody has the misfortune of losing all of their teeth, or in a situation where their teeth have to be removed or have had decay, life happens. Sometimes we neglect our teeth because we're taking care of a loved one, or who knows why. I mean, stuff happens. And so the beauty of it is we can reconstruct it, and we can reconstruct it to almost perfection, almost to the same level as what their teeth were prior to decay or to periodontal disease or to losing their teeth. But the patients need to understand that it's a process, and be willing to go through that process and each step, so that, in my practice, so that I can deliver on what I've promised. And they can trust that. They can trust that I will not cut corners on materials, on time, healing time, on technique, surgical technique, prosthodontic technique, prosthodontic materials. I will only use the very best stuff because, I've been doing this for 20 years and I plan on doing it for 20 more years. And if the moment that, a person starts cutting corners is where things just start falling apart. Kind of like you said, Memo, the analogy of building a house in a week. I mean, is it possible? Maybe, I don't know, but I wouldn't really trust that house,
I wouldn't feel safe. Yes.
And imagine spending the money on that house, and you're going to spend the same amount of money whether it's built in a week or in 6 or 8 months or 2 years or whatever. So, I would rather spend the money on a structure that I know is going to withstand, earthquakes and rainstorms or whatever,
Yeah.
and can handle the day-to-day routines of the area that it's being built in.
Of course.
And our mouth it's a dynamic environment. It's an aqueous environment. It's a wet environment. There's bacteria. There's a lot of force. When you bite down, it's 450 pounds per square inch. So every time you bite down. So, all of these things need to be taken into consideration. And what's being built and the foundation that's being laid needs to be able to withstand all of those factors. And if any piece of that can't withstand those factors, it is a certain failure. Like, if you built your house out of, in a week, but you had to use a cardboard roof, one rainstorm and the thing's going to fall apart. So,
Right.
That's kind of a silly analogy, but it's true. I mean, if the whole case is built and the prosthesis is all plastic, and you're expecting that plastic to take on the load that a mouth has to take in order to, chew a steak or eat raw vegetables or whatever, at some point something will break if those materials are not sufficiently made and designed in order to withstand the forces and what our mouths are designed to do. And so I need to build a design that will, with proper materials, that can withstand all of those forces.
Yeah, of course. So you just cautioned patients, right? To be careful with these practices who are claiming this, but what do you recommend they should do when they come across an ad like this or a billboard? Like, what can they do in order to avoid that or to get the best outcome for their mouth?
That's a great question. The issue is there's within the the marketplace, it's being inundated with these all on four, teeth in a day, teeth in 24 hours, ads. And so, doing research, understanding really what it is that they need, because every case is different. Every single patient that I treat, I have to navigate their case differently than the patient the day before. So, understand what is being done, what the outcome should be, what materials are being used, and also kind of like we talked about before, the credentials of the doctor, because if the doctor has spent sufficient time in training, university-based, bona fide implant training, then they're only going to use high-quality materials. If they haven't had that, and or if they have just gotten into the implant game, let's say that they've only been into their practice for 3 years, or they've started advertising and all of a sudden they realize, wow, my ads are working and I'm generating some implant leads and implant cases, but now they have to deliver on those cases. And their failures probably won't show up for a year or 2 years down the road, but if they have cut corners anywhere in the process, they certainly will find and they'll see their failures. And so unfortunately, it's some of those patients who have kind of fallen for those ads and gotten mixed up in that process. And at that point, it's too late. They've spent the money, they're already, the prosthesis may be finished, so there's no kind of going back. The implants have been placed and they've been placed in the position that, that they are, and usually with an all-on-4. Everything is concentrated in the anterior or the front. So there's no implants in the back of the jaw or the posterior. So, all of these things have already been done. So to go back and rectify or correct these things, it's really tough. In fact, it's impossible. And I say that from first-hand experience.
Right.
Like I've mentioned, I took over the Smile Implant Center in Southern California, which was one of these teeth in a day, all on 4, quick, come in, come out next day, get your teeth centers. And within about 5 years, the wheels started to fall off and cases were just falling apart like crazy. So the doctor was removed from the practice after many situations. The ultimate thing was a death that occurred. And so once he was removed from the equation, the dental board contacted me to come and clean up, because once the doctor's out of the equation, then the board, now they are in charge of those patients. So they knew my background and my training and credentials that I have, and so they brought me in to rectify these cases. So, and we've talked about this many times. So I've seen firsthand the effects of a patient who kind of fell for one of these teeth tomorrow ads, and the ramifications of having fallen for that and how it affected them. They had to entirely do the case again. I had to remove implants, had to redo the prosthesis, had to add implants. They paid probably 2 to 3 times of what they normally would have paid, had they done some research. And there's a lot more information now that patients can get, and they can come in with, kind of more savvy and a little more guarded as to how they approach, when they make that decision, how they approach that. And so, you know, my advice is do your research, make sure that you're going to a doctor who has bona fide university-based training and, you know, can show you results, you know, that can show, you know, I even have in my practice, I have patients that they can call, talk about the experience that they've had. Because it's important. I mean, unless you've been through the process, you have no idea, you know. Right. And it's an important step for patients to take. The timing of when they do it, how they do it, who does it, all of those are critically important steps, because when it's all done, it's so worth it. It's worth every penny, it's worth every effort, it's worth the time that it takes. It's a transformative procedure, and I've seen it time and time again where a patient, you know, they come in a certain state, and after I take them through my processes and they're finished, and it's what I love about what I do. It literally transforms their life. You know, now when they go out to dinner, they, you know, eat whatever they want. Their self-confidence is restored. Their you know, it's just an amazing process. But when done correctly, it's one of the most predictable procedures. But if it's not done correctly or the materials aren't the most ideal, it can be, you know, catastrophic and really have a negative effect on the patient. And you'll see it, you know, dental implants can get a bad rap, but dental implants are the success rates are so high with the dental implant. And when they're done properly, it's one of the greatest procedures and investments you can make for yourself.
Yeah, of course. Well, thank you, Dr. Willardsen, and thank you for being so honest. I firmly believe that the industry and patients who are looking into getting dental implants need this. They need this honesty. They need videos like this.
They do, yeah.
To be able to make that right decision and only do it right once. Like,
one time. Yeah.
Choose the right doctor. Thank you again. And thank you for watching to all of our viewers and subscribers. If you haven't subscribed yet, make sure that you hit that subscribe button. If you find these videos helpful, hit that like button. And if you have any questions or if there are any topics that you like for us to cover, make sure you leave a comment in the section below. Again, thanks for watching.